Hello, my name is Kathy Shalou. I'm a lymphedema therapist and I'm the director of our lymphatic treatment center at the Boston Lymphatic Center. And I'm going to be talking to you a little bit about compression. It's the one topic we spend the most time discussing, and it's usually the topic that we get the most questions about. So I thought I would spend some time discussing with you different compression options, and through that, hopefully answer your questions. Let me just share my screen so that you can see some of the slides that I've put together to help guide the discussion. First and foremost, the most important component of being able to control lymphedema is going to be compression. You're going to spend the most time dealing with your compression garments and the most number of hours during the day, so it's really important to get it right. One size does not fit all. Every patient has different activity level, severity of disease, and what type of garment works for one person wouldn't. And activities that you're doing can affect the type of compression garment that you need. And it can vary by activity, by season, and year to year. So what you need now might not be what you would use in the middle of the summer if you're exercising out in hot and humid weather, or whether you're working at a sedentary desk job where you're sitting. So different needs for not only the environment, but also the type of activity. Really keep those in mind as you're trying to think about what types of compressions you need. Different types of compression early on in your course of treatment. Oftentimes we use compression bandaging as an initial point to help decongest a limb and try to reduce the size. And then you might put somebody into some kind of compression garment like a stocking, a glove, sleeve. There are also inelastic compression wraps. You may have seen those. They're made of a softer material and often have Velcro. So they're slightly adjustable. And they're inelastic, meaning they don't expand. They contain a little bit better. So they're ideal for somebody who has more severe edema. They can also be worn at night because they don't wrinkle quite as much. If there are garments specifically made to be worn at night garments, and they're made of more softer, foamy material that doesn't bunch up and pinch, and it can be more comfortable if somebody just needs a light compression to wear. And then compression pumps. You get a lot of questions about compression pumps, and probably I could talk for a lot longer just about them. But really, you should know that that would be an adjunct to treatment using compression. So we would add on the compression pump maybe after we didn't get good control using a compression garment only. If you think about the number of hours per day, you really have to be wearing a compression garment for most of the hours during the day, and then you might use a compression pump in addition to. It's usually not in the place of. You may hear terms flat knit, circular knit, ready to wear, custom garment. Just so I thought I would explain those a little bit. I tend to think of the way that the garment is constructed, the weave, the knit, circular versus flat knit. And this is an example of a circular knit garment. It's kind of a close weave. It's a thinner material. It has more elasticity. So it's good for milder cases of lymphedema or flat knit garment. You can see the weave is a little bit heftier. The stitches are a little bit stronger. They don't have as much elasticity, so they contain better. They don't give as much during the day. So that might be a go-to for somebody who has more severe disease and the limb increases in size during the day. Both of these can be made custom or ready to wear. So the decision for a custom garment or a ready-to-wear garment really has to do with the size and the shape of the limb, and maybe some of the features of the skin or bony prominences. So you can see that this garment is more custom made. It's shaped to the limb a little bit better, so it fits more closely, versus a ready-to-wear garment, which is made, if the limb is less shapely and more cylindrical, this might be ideal, a ready-to-wear. The ready-to-wear garments come in a variety of sizes, small, medium, large, extra large, and there's, each manufacturer makes an array of sizes that would fit most of the general population. And it's only when somebody doesn't fit into that we might think about going into a custom-made garment. But really fit is what we're looking for with this. The amount of compression, a key component, you may have heard the terms class 1, class 2, class 3, class 4, has to do with how much compression is woven into the garment. Most compression garments are made, constructed so that there's more compression at the foot and the ankle and less as you go up the limb for the lower extremity, and the same thing for the arm, less compression and more compression at the wrist, less as you go up the arm. So it's graduated. Class 1 usually represents about 20 to 30 millimeters of pressure, and class 2 and class 3 increases the compression beyond that. So that's one way to increase the compression. If we're not getting good control in one class, we might increase the class of compression so there's more compression being used in the garment. But that's not the only way. You can also layer compression garments, wear a waist-high stocking with a knee-high stocking on top of it if somebody has really more segmental edema only in the foot and ankle that's not being kept under good control. If somebody can't tolerate a higher level of compression across the whole limb, but we need extra compression in one area, we might put a layer on that. Another way is to replace the garment more often. We know that the lifespan of the garment is about 4 to 6 months, and at the 6-month mark, it's really stretched out. It might feel more comfortable, but in fact, it's actually stretching out. It's probably not going to continue to do that as well. So rather than waiting for it to get stretched out, we might replace it at the 4-month mark. Where I've even seen some people who replace them every 3 months, because as soon as it starts to lose its stretch, it doesn't continue as well. And then the other component to think about is how many hours are you in compression per day? If you're only in compression for 8 hours a day and you're finding that your edema is increasing, that's a signal that you really want to increase, and don't take that garment off. Put it on first thing in the morning and take it off last thing you do before you go to bed, so that you're in it all waking hours. So the number of hours per day and per week that you're in compression really does matter. Lastly, how do you know that your compression garment is working for you? One of the things I tell people to think about is your edema control maximized? Are you getting the most out of your compression garment? Are you still getting a lot of hitting edema? Then your compression garment is probably not doing the best that it can for you. You might have to think about some options. Is your volume stable over time? If you notice the volume of your limb is increasing, again, that would be a reason to start to think about a different type of garment. And if you find that it's not working for you, ask your physician or lymphedema therapist or fitter and discuss what other options might be available to give you better control. But overall, the things that I want you to think about over time is it's a dynamic process. We know that lymphedema is a progressive disease, and your needs for compression will change over time. We want to make sure that you prevent progression of the disease, so that reassessing your needs for compression over time would also be important. I would also suggest that you get remeasured on a regular basis. Go back and see the lymphedema therapist and get measured on an annual basis to make sure that your volume is not increasing very slowly and you're not noticing it, and to discuss compression options. So that's just a brief review of some of the main things I think about in thinking and trying to decide what kind of compression garment would be good for somebody. I wish you good luck and keep your edema under control.